For the last few months, I've been struggling from an acute pain in my lower back. I've got better days, but I also have days when it's really hard for me to even bend down and put my socks on. Coincidentally, at the same time when the pain started, I've also started working out in an outdoor gym with my best friends without any supervision of any personal trainers, which leads me to believe that there is a connection between the two. Obviously, there is a connection. And this really angers me because my lack of knowledge is negatively affecting my health, and that's not acceptable. So, to solve this problem, for the last few weeks, I've been listening to lectures, watching YouTube videos, talking to physiotherapists, reading articles, both scientific and on blogs, about the whole topic of the spine and proper posture and how to maintain an overall spinal health. This recording is a summary of all the most important informations I've learned. I'm recording it for you to help you and give you the most actionable advice, but I'm also recording it for myself so that I can come back to it in the months and years that follow as I embark on my new journey of taking care of my spine and my posture health. All the notes that I've taken are linked in the description, and you can also find their links to all the sources that I've used. Please note that if you do struggle with acute pain in your back, the best thing you can do is see a physiotherapist that will help you and tell you exactly what you can do to alleviate that pain. But now, without further ado, let's start the presentation on healthy spine. Okay, let's rock and roll. How to care for the spine and maintain a good posture. The presentation is going to be divided into 4 parts. In the first one, we're going to look at the spine, the anatomy of the spine, and what causes pain in the lower back. In the second part, we're going to focus on posture, what makes a good posture, and what are the causes of a bad posture. In the third part, I'm going to introduce some easy exercises that everybody can do at home while sitting at the desk or on a yoga mat. 10-minute exercises, very easy for maintaining good spine. And in the last part, we're going to look at strengthening of the back. So what we can do at the gym, which exercises are the best for a healthy back and a good posture. Let's start with part 1, the spine. So this is more or less what the spine looks like. It's kind of weird looking, like a snake or some sea serpent creature. From the front, the spine is completely straight, provided that somebody doesn't have scoliosis or some other problems with the back. And from the side, the spine is actually curved. It has 4 different curves. It's comprised of 33 vertebrae, and the first 7 are in the neck. They are called the cervical vertebrae. The next 12 are in the chest. They are called the thoracic vertebrae, and these are the vertebrae connected to our ribs. Under our chest, or the thoracic cavity, we have the lumbar spine, and these are the 5 vertebrae that make up the lower back. Underneath that is the sacrum, which is made out of 5 vertebrae that are fused together. And under the sacrum is a coccyx, which is 4 vertebrae also fused together. Coccyx is also known as the tailbone. So this is what the spine looks like. Now we're going to look closely at the vertebrae. The part that is the most important to us is the disc. And the disc is very interesting. It's like a little cushion that's sitting between the vertebrae, and it's kind of like a spring or like a rubber. It's made of 2 components, and there is in the middle a very soft, gooey nuclei, and on the outside are the outer layers of the disc. A good way to think of the disc is to compare it to a donut. So a donut would have a creamy, gooey inside, and on the outside it would be soft and it's squishy, but it always bounces back to its natural state. That's kind of how the disc works. The spine is one of the most important parts of our body. It's giving our body, our skeleton, a full support, as well as giving it its shape and length. And also, one of the most important parts of the spine is to protect the spinal cord. Now, spinal cord is a main highway for the nerves that's going from the brain, and it's then going down through the spine and then reaching out to every organ, every part of our body. Every vertebrae has a hole in it called a foramen magnum, and through this hole goes the spinal cord and is perfectly protected by the spine. From the spinal cord, at every single vertebrae, there are nerves that are going outside and reaching to different organs. And they are directed outside via transverse septums. Those are the little nudgy thingies, the little fingery thingies going outside of the vertebrae. And the nerves in this location are especially interesting to us when we're thinking about the pain that we feel in our lower back. Now, when we talk about pain, we mostly are talking about discs, something happening with discs. There are other causes for pain in the lower back. For example, if we suddenly start doing some activity, especially connected with some heavy lifting, and then muscles that don't normally work are put to work, then the next day we would have soreness from an overworked muscle. And that soreness could also cause pain. But the soreness also goes away after 3, 4 days. If the pain persists for a week, two, three, a month, then we're talking about a spinal problem and mostly a problem with a disc. And there are several problems that can cause pain. We're going to look at all of them. On the very top here, we have a beautiful, healthy, squishy, bouncy disc. Underneath this disc is one that's going through degeneration. That means the outer layer of the disc is being overworked or overstretched, and there are cracks called fissures that appear in this layer. It's mostly due to the disc not being flexible, not being hydrated enough, and we're bending our body in an awkward way that it's putting a lot of strain on the disc, which causes degeneration. It also happens with age. It's very common and nothing to worry about. The problem starts when a bulging is happening. Bulging disc is a situation when the outer layer starts cracking, starts degenerating, and is going outside of its normal parameter. Now, a bulging disc is actually super common. In fact, this is a graph of percent of people that might have a bulging disc right now without experiencing any symptoms, without feeling any pain. So you can see that even people in their 20s, there is a 30% chance that someone would have at least one bulging disc and not feel any pain. And this number increases with age. So bulging disc is a very common situation, but it's always caused by a badly maintained spine. This whole presentation is about how to care for the spine so that bulging doesn't happen. So, what are the causes of bulging discs? The number one cause is age. Basically, the longer we use our spines, the longer we use our bodies, the more and more things degenerate in those bodies. And that's the same with discs. And when the discs degenerate, they start bulging, and that could cause pain. I just realized I didn't explain how pain is connected to a bulging disc. So let's go back. When the outer layer of the disc starts degenerating, starts cracking, that's when inflammation appears in the spot. Simply speaking, inflammation is a place that's not working properly within the body. And it's also sending signals to the brain that there is problem in the spot and it needs to be fixed. That signal is pain. But it's very important to emphasize here that we can't just throw in the towel and say, okay, I'm aging, so I've got bulging discs, there's nothing I can do. Remember that there are two kinds of aging. One is aging when you gave up and you are not maintaining your body and you let everything deteriorate. Or there's aging when you're still active, when you take care of yourself and you feel healthier, more vigorous, have more energy, and your life is of a better quality. Even if you lived on this planet for longer than you wish to admit, there are still things you can do to be healthier and feel better in your own body. A second symptom of a bulging disc is carrying weight. So when we pick something up without straight back, or if we go to the gym and we exercise wrong, like this guy, or we are carrying boxes or moving house or whatever, if we overwork or overstrain one area of our body, and if we don't move our spine, our pelvis in the right way, then we're putting pressure on one side of the spine, and then the other side is popping out, bulging out. The third most common cause of bulging disc is a bad posture. If we look at the phone for most of our day, if we are hunched at the desk, we are continuously putting our spines in the wrong bend, which causes bulging discs. The fourth cause are impact sports. Basically, if we are doing something super active and there is a sudden impact to our body and our body is bent in an awkward way, like during boxing or snowboarding or American football, then it can cause one or more of our discs to pop out. A fourth cause, and this one's quite interesting, is a lack of hydration. It turns out our spine, our discs need a lot of water. And actually, the whole body needs a lot of water. So if we're not hydrating enough, if we're not drinking enough fluids during the day, then the body has less resources to distribute around. And so our discs are getting less water. If they are less hydrated, they are less pliable. If they are less pliable, they are more prone to bulging, to degeneration. And the fourth cause, and this one's the most surprising for me, and I'm sure for you as well, is smoking. It turns out that nicotine has a very negative effect on our discs. I can't explain it in a simple way because I'm not very apt in the science, but bottom line is nicotine affects the amount of nutrients that our discs are getting from the bloodstream, and so the discs are degenerating faster if we are smokers. So these are the most common causes of the bulging discs. Now, if the disc is bulging for a longer time or there is more pressure applied to one side of our disc, it can lead to a herniated disc or hernia. Hernia basically is middle part, the gooey part of the disc coming out through the layers, through the cracks in the layers, and then pressing on the nerve. And when it's pressing on the nerve, it's not letting go. And so we feel the pain constantly. We feel it when we stand, we feel it when we sit, we feel it when we lie down. There are different kinds of hernia and different things that could happen in this situation. But one thing to remember is that it's not the end of the world. It's actually quite curable. Not every kind of hernia needs a surgery. You can treat it or decrease it with healthy exercise and just rest for a few days. But if you think you suffer from hernia right now, the best thing you can do is go and see a specialist, doctor, a physiotherapist that can definitely check what type of hernia you have and what's the best course of treatment. So hernia is a mega bulging disc that is pressing on one of the nerves. And finally, a thinning disc. A thinning disc is basically a disc that is super dehydrated. It's been used for many years. There's been a lot of degeneration happening, and the outer layer is decreasing in its volume. And that causes the two bones, the two vertebrae, to start colliding and grinding. And yeah, this is a super non-fun situation. In the worst case scenario, it might be necessary to have a disc replacement therapy. By the way, I super recommend going on TikTok or YouTube and watching animations of how they do a disc replacement therapy. It's mind blowing that we have this technology and what they're doing. Super cool stuff. Okay, so these are the causes of problems with the discs and associated pains with that. Now, for the rest of this presentation, we're going to learn what you can do right now, today, to start treating your spine with all the love and care that it deserves so that it can carry you through so many adventures of life. So, part two, posture. We're going to compare good posture versus bad posture. What are the differences? From now on, you'll always know and you'll always notice. So, first thing first is the ear line. The ear must be on the same line as the shoulder. If the ear is forward, that means our neck is forward. That means our spine is too rounded at the top. This is probably the most common posture problem. This is a problem I've got. It's a problem that everybody has. In fact, when I learned this information, I was taking a bus the same day, and when I looked around, every single passenger had an ear slightly forward from their shoulders. So this is a very common problem, and I'm going to give you some tips on how to correct it. The second characteristic of a good posture are shoulders that are moved backwards. Again, very common. This is also something that I have, which is rounded shoulders forward. Now, the third aspect of a good posture is chest, rise up. So it goes up with the shoulders. Once we move shoulders to the back, the chest automatically goes up. Sometimes it needs a little bit of help, but normally it's one movement. The fourth characteristic is the lower back is relatively flat. It will never be flat because remember, on the lumbar spine, there is a curve, but we don't want this curve to be too big. We don't want the butt to be sticking out. If you look at pictures of models on Instagram, you'll notice that most of them position their butt to be sticking out super far, and they have this massive bend on their back. I've actually never noticed it before, but since learning about this, now I see that bad posture on Instagram models everywhere. And the last characteristic is the position of the hand. So you want your thumbs to be facing forward. You don't want the thumbs or the palms to be going inward, because if the palms go inward, your shoulders are rounding with them. If you move your thumbs outward and you direct them in front of you, then your shoulders automatically round back. And these are the characteristics of a good posture. Now, when you are outside and you look at people, try to see for those characteristics. These will also help you maintain your own posture because you will see it on other people. Okay, now let's look at some combinations of common bad postures. These pictures are a massive exaggeration, but I'm sure many people will fall into one or two of those categories. So the first one is forward neck. This is something that I have for sure, and is basically the neck is sticking out super far. This is mostly due to looking at the phone all day or sitting too much at the computer. The second bad posture is called a rounded shoulders, and this is when our shoulders are too slumped or too rounded forward. The third one is a posterior pelvic tilt. This is the Instagram model position. It's when the butt is sticking out. And the fourth one is the opposite of that, a anterior pelvic tilt, where our back is way too straight than it should be. The last example is, of course, a perfect posture. As you can see, the ear is on the same level as the shoulders, the neck is back, the shoulders are back, the chest is raised high, and the lower back has a bend, but it's not that big. Okay, so now we know what a good posture looks like and what a bad posture looks like. Now let's look at what causes bad posture. And I personally think this is the most important and also probably the most interesting part of this presentation. So, first, we need to remember that our bodies are made to move. Our past is full of movement and activity, and it's only now that the human species is experiencing this inactivity epidemic when to do something we have to sit down for hours on end and only move our fingers. So, the causes of bad posture derive from two different extremes. One of them is too much movement, and that could come from too much sport or contact sport when we're not properly stretching our bodies before work, or physical work on a construction site, in restaurants, delivery services, and so on. The other extreme is not enough movement. And I think most of the people, including me, listening to this presentation fall into this category. So this is sitting at the desk at work for many hours and then going back home and then slumping on the sofa and watching Netflix for another few hours. When we fall into one of those two extremes, too much movement or not enough movement, over time, some parts of our bodies are overworked and the other parts are inactive, made weaker, and so they cannot support our body in a proper way. And this is putting more and more strain on our spine, which causes bulging, which causes hernia, which causes pain and problems. What we want to do is very simple. We want to introduce as much movement into our daily activities as possible. So we want to go for walks. We want to get up from the desk, stretch our legs, go make a coffee, go with our dog, or even water the plants. Most experts agree that we need to do some sort of movement at least every 30 minutes. The second thing we want to do every single day is stretch our bodies. Relax all the muscles that have been overworked that day and stretch the muscles that haven't been used while sitting. And lastly, we want to make our body stronger. And I absolutely love this reason because for most of my life, I was going to the gym with a cosmetic motivation. I wanted to look good, I wanted to have big muscles. But this actually introduces a different perspective. I need to go to the gym to strengthen the muscles in my body that are inactive when I'm sitting in front of my computer. Now, for me, this is huge because in the last 3 weeks, I didn't need to motivate myself to go to the gym because I was doing it for health. I was doing it for myself. I was doing it because I had to do it. So, what actually happens when we are inactive and sit down for too long? A few things. First of all, our big muscle on our back, called middle trapezius, is overstretched. Second thing, one of the muscles in our neck, called the sternocleidomastoid, which is this muscle here, when we are moving our neck forward, is shortened. It becomes stiff. Here's a different look at this situation. On the left, we have a healthy position of these muscles. On the right, we have an unhealthy situation, an unhealthy position of these muscles. The one on the back is stretched, and the one in the front is shortened. When we're sitting down, this is what it looks like. All the blue muscles are tight, meaning they are bent in one position and never stretched out. Now, even worse than that are the brown muscles, because these are completely inactive. That means when we're sitting for too long, these muscles do nothing. And over time, they're becoming weaker and weaker. And that's why we need to go to the gym to strengthen these muscles that we're not normally using. To make things even worse, our spine is also super unhappy because if we're hunching while sitting at the computer, our spine is compressed in an unnatural bend, which means more force is going to one side of discs in the lumbar spine than to the other, which means bulging discs. And if this situation persists for a longer time, it's leading to a hernia. Okay, and what benefits do we get from a good posture? I'm glad you asked. Good posture means a proper blood flow in all areas of our body because the pressure on our veins is minimized. It means easier breathing because our chest is made to breathe when we are standing straight. It means a better hormonal balance. It means more stable spine, which leads to less injuries. There's less stress on joints and bones, fewer headaches and back pain. And lastly, more energy because our bodies are functioning in their fullest potential. Moreover, good posture means more confidence. When we are standing tall, we are radiating charisma. People want to talk to us, they want to interact with us. At work, we give off this aura of confidence that people respond to. And we ourselves feel more ready for all the problems that life wants to throw our way. So by now, I hope that I convince you that bad posture is really bad and good posture is really great. We can move on to the next section, which is daily care. What can we do every single day to maintain a healthy spine that will over time lead to a very straight, confident posture? We're going to look at two different things. One, what can we do while working? And second one, what can we do in the evening or in the morning for 10 minutes? So, working. First, we're going to focus on three areas: the neck, the upper back, and the lower back and the sit bones. I've got 8 exercises total. They are very easy, very safe, and can be done while sitting. So the first one is tucked chin, and we want to release it from the constant tension that is under by tucking our chin and moving our head backwards. Second exercise is looking up, which is stretching this jugular muscle here because it's normally shortened. So we want to look up and raise our chin as high as we can. Some people might think this is not safe. That's not true. This exercise is 100% safe. It's not going to cause any problems. And lastly, we want to move our head side to side to stretch both of these muscles from a different point, from a different perspective. We can do all of these exercises in a sequence. So tuck our chin, look up, and then move it side to side. You can do this as many times as you want, but I don't recommend doing it too often because then the neck starts hurting. Next, we're going to stretch our upper back. There's a really cool exercise called YWLT. And what we need to do is make the letter shapes with our hands. So we move our hands to the position of W, then Y. With L, touch your elbows to the side of the body, and then T. You can do it 5 times, or you can do it for 30 seconds. Another exercise is seated cat cow. So this is a very famous yoga position, but you can also do it while sitting. So you want to bend your back and touch your chin to your chest. And then while looking up, you want to bend your spine in the other direction. You can do it 5 times or for 30 seconds. The last set of exercises stretches our glutes and hip flexors. So the first one is extended leg. Sit at the edge of the seat, extend one leg. Remember to keep the back straight and then try to reach out to your foot. Do it for 30 seconds. Another exercise is put one leg on top of the other, knee bent in a 90-degree angle, and with a straight back, move your chest towards your knee. Again, do it for 30 seconds on one leg. And the last exercise is to stretch the arms, make them straight in front of you, position the palms downwards and then sides. And you can do different variations of this. All of it will be stretching this whole area. All of this will be stretching different muscles in your shoulders. All of these exercises are really good, but while sitting down, we cannot access all of the muscles that we would want to. That's why I also prepared a 10-minute stretching routine that can help strengthen the muscles that are weakened while sitting and also relax the muscles that are tight or overstretched. So, the routine is taken entirely from Jeremy Either's video, The Perfect 10-Minute Daily Posture Routine. I 100% recommend this video and Jeremy's channel. He's doing some really incredible work. If you don't know this creator, I highly recommend him and his videos. The routine has 8 exercises, 4 on the upper body and 4 on the lower body. It's up to you how you want to do these exercises. You can do 5 repetitions, 10 repetitions, or like me, you can put a timer for 1 minute and then do each exercise for 1 minute, which altogether will be 8 minutes total. So the first one, you want something long, like best would be an elastic band. I don't have one, so I'm using a scarf, but you can also use a belt. You want to keep your hands straight, and then starting from the front, you want to make big circles around. And this exercise is helping you with movement in your shoulder joints. The second exercise is a cobra pose. This exercise is fantastic because it's a complete reverse to a sitting position. So every single muscle that's compressed while sitting is stretched while in cobra. To do this exercise properly, you want to raise your knees and then you want to position your hands on the same level as your shoulders. Then gently you want to lift your torso and remember not to push with your hands, just use them for stabilization. The third exercise is turning the torso to the sides. You want to put one hand on the hip and stretch the other hand towards the ceiling. Do it for both sides for about 1 minute. The fourth exercise is a complete game changer. I absolutely love this exercise. Every time I do it, I feel very good and I feel my body and my posture is finally in its proper position. What you want to do is to stand by the wall. Your feet are about one step in front of the wall. And then it's really important to make a contact with every part of your back with the wall. So the lower back, the upper back, and also the head. You want to tuck your chin down and put your hands and your forearms on the wall and then slide them up and down. This exercise is really hard. Try to do it for 1 minute, 1 minute and a half. You'll really feel the difference. So these are the 4 exercises for the upper back. Now, the lower body, we also have 4 exercises. It's best to do them on the yoga mat. The first one is turning torsos. So you want to position yourself on the mat, one hand straight in front of you, put the other hand on the back of your neck, and with your elbow aim at the ceiling and follow the elbow with your eyes. Do this for both sides for 1 minute or 30 seconds. The second exercise is stretching your hip flexors. To do this properly, you need to fix your pelvis in the right place. So you want to rotate your pelvis down. So imagine that with your belly button, you're trying to aim upwards. And that way you're really feeling the stretch on the leg that you're kneeling on. The third exercise is called the pigeon pose. You want to position yourself on the mat. One of your knees is bent in a 90 degrees angle. And then keeping your back straight, you want to lower yourself towards the knee. It's very similar to the exercise we did on the chair. This exercise will really help you activate your glutes. And then the fourth exercise, also for the glutes, you want to lie down on the yoga mat and then raise your entire body only keeping your shoulders and your feet on the floor, and try to raise your body as high as you can. If you want to add an extra level of difficulty, you can raise one of your legs. So, this is a simple routine that will help you decrease the damage caused by sitting for too long. You can do it in the morning, you can do it in the evening, you can do it twice a day, you can do it 3 times a day. It's really up to you. But just this routine will not be enough. You also will need to strengthen the muscles that are being underused while sitting down for too many hours. And to do that, we're going to look at a training program that I've created after watching seriously hours and hours of back videos on YouTube. I've based most of my exercises on videos from these two creators. One is Jeff Cavelier from Athlete X, and the other is Jeremy Either, whom I mentioned before. My routine is based on a combination of routines that they introduced in these videos. I highly recommend all of these videos. These two personal trainers are really putting out some very informative content. So, my back routine. It's 8 exercises and it takes about 45 minutes to finish. It's quite intense, but I've done it 5 times already. And I really feel the difference in the quality of my stance and how I feel my posture changing. I don't have to think about my shoulders going back because I'm doing exercises that strengthen the muscles that keep my shoulders back naturally. So the first exercise is the king of all exercises, which is deadlift. Remember to always start with a warm up. I actually use my spine routine as the warm up for this program. So, 3 sets of 8 repetitions of a challenging load on the deadlift. After deadlifts, I stay with the same bar and move to dead rows. Jeff Cavelier proposes this technique where you're loading enough weight to make this challenging and start with 12 really quick, kind of sloppy repetitions to ignite your muscles. Then you wait 15 seconds and you proceed to doing 20 effective but very precise repetitions. And it doesn't matter if you have to take breaks or how long it's going to take. What's important is to finish all 20. After dead rows, I move to lat pull downs. I keep my grip wide and I don't put the bar behind me, I put it in front of me. Again, the same protocol, 12 quick repetitions, 15 seconds break, and 20 effective repetitions. After lat pull downs, I move to seated cable row and I start with a wide grip. My elbows are bent in about 45 degrees angle, and this is activating the upper lats. After 20 effective repetitions, I stay in this exercise, but I change the grip to a close one with the elbows really close to my body. This is activating my lower lats. Then I move to an exercise that's actually quite new to me, which is Y arm raises. And for this one, you really need a lower weight. I actually use dumbbells of 2 kilograms. You position yourself on the bench like in the picture, put it on 20, 30 degrees, so second or third rung, and raise your arms in a letter Y. This is activating the lower part of the large trapezium muscle. And this exercise is actually activating the only muscle that is keeping your shoulders back. It's a muscle that's really difficult to target with any other exercise. So this one is absolutely essential, and I actually never done it before. After this one, I'm going to station where I normally do squats, and I'm doing inverted row, which is basically an opposite of a push-up. This exercise targets most of the muscles on the back, and I normally do it at the end of the program to give this extra activation to all the muscles targeted before. And here I do 20 or sometimes more of effective repetitions. The last exercise is really good to do, but it's not essential, and it's back extensions. It's not essential because doing deadlifts, you are already targeting the lower back. But because lower back is quite inactive while we're sitting and is very important for keeping our spine straight, then I think it's good to do 2 exercises that will target it. So you want to go to the stationary machine and using just your body weight or a weight of 10 or 15 kilograms and do the back extensions. To do this exercise properly, you don't want to overbend your back. You want to go into a position where you're in one line with legs and then bend forward. Remember to keep your back straight at all times. And that's it. That's the whole routine. It takes about 45 minutes to 1 hour, and it effectively targets all the main muscles that are inactive while we're sitting down all day. Now, there are a few exercises that I didn't include in this program, and they are listed here. All of the exercises on the right are also perfect. I chose the ones on the left from a personal preference, and also didn't want this exercise to be too long as I don't have as much time to spend at the gym. And that's it. That's the whole presentation. I hope you learned something today. I hope that now you know how the back works, what causes pain, and what can you do every single day to keep the back straight and healthy. I know it helps me, and for the last 3 weeks, I've been doing all of these exercises and routines, and it really makes all of the difference. I dedicate less attention now to keeping my back straight, and this position of a straight posture is more natural to me. I feel healthier, and I did get a lot of compliments on how I seem a bit more grounded, which is always nice to hear. Please write in the comments what you think about it, and if you know anybody that could benefit from this presentation, feel free to send them this video. And yeah, see you in the next one. Cheers.